Elevate TV, advancing kingdom lifestyle.
Good morning, this is Elevate Television Kenya, and this is the Morning Digest Wednesday edition, and we advancing kingdom lifestyle. But before we get into our show today, I want to welcome you to go to your link. The link is already out on Facebook, on YouTube, and even on Instagram. By the way, if you have not liked the pages, please do so, and do that urgently, because everything good, you will be among the first people to get it. And so already the link is out. I'm sending it out to my friends. So this is a drill. You know the drill every morning. Let's do that. Send your link. Mine is already sent. And on YouTube, remember, this is a day you can, using that link, you can be able to communicate to our guests, and they will be able to answer any question you have, anything, any question you have on any of the matters we'll be discussing today. You can engage them, and you can be able to be part of this conversation, but you need to be online. Remember, you can post this on your, WhatsApp groups. Some of you belong to family WhatsApp groups, estate WhatsApp groups. Some people have issues with their dental, not formula, but they have dental issues. But today, we're not going to be dealing with just dental issues. We're going to be talking about the innovation and the transformation in this noble task. So, with me in studio, I have doctors, so I'm the only guy without a credential. So, karibuni.
Thank you.
Let me begin on my far right. That's Sylvester Daktari. Karibu sana. Please look at that camera. Introduce yourself. Let's let the people know you're on today.
Thank you. Thank you, Moses, for having us. My name is Sylvester Mwako. I'm an oral health officer, and I'm also a health systems manager. Health systems revolves around the pillars or the building blocks that forms health systems, including, leadership and governance, things to do with healthcare financing, things to do with health service delivery, human resource of health, medical products and technologies, and those are the basic, blocks or building blocks that make health systems. So that is my name, and we are here today together with my friend to talk about what Moses talked about, and we are excited about this. Thank you.
Karibu sana, Dr. Gaitho. Please look at that camera and introduce yourself.
Thank you, Moses, for this invitation and Elevate TV. My name is Elder Dr. Peter Gaitho. I am a Christian dental surgeon and the CEO of Elephant Dental. I have 18 years of experience in matters dentistry, and I usually joke, Muiruri, that kazi yangu ni meno na neno, because I'm an elder with the PCA Church. But because today we are talking about teeth, so I wear the hat of meno. And I'm glad for the invitation.
You're first an elder then.
Yes, first an elder, then a dentist.
Well, that's an amazing thing to wear two hats.
Elephant Dental prides in having 45 branches.
Wow.
In Kenya. And we have spanned around 22 counties, giving quality and affordable dental solutions. And we are glad that we can shout loud about what we have done and what we are doing, and we look forward to interacting more with your viewers.
Wow.
Thank you.
We'll be talking about elephant in a few, but just to, I always have this question in my mind, and I want to throw it to you, Sylvester. When you're growing up, did you ever think of being a either going into dental or into medical?
Well, that's a good question, Moses. I grew up in an environment where getting a dentist was a nightmare, and I remember one time when I was young and growing up. One time, I had a very serious toothache. I think I was back then I was standard 7, so I think I missed school for a whole week, and I could not eat anything because the tooth was swollen. There was nobody, nobody who could take care of that.
Even a herbalist.
So, well, I remember my father took me to a nearby health center, and when I went there, they only gave me some tablets to take, and from there I was taken back home because there was nobody who could attend to it. So then later on, when I continued with my studies, I realized that there was a gap, and by God's grace I developed a passion, and that's how I ended up being in this profession. And I'm excited because today we are going to talk about some of the issues that are affecting our people, especially in the underserved areas and communities, and how these people can find help. So we are excited, and yeah, thank you.
Dr. Gaitho, like he's saying, I grew up in a community where you had to look for a dentist. There was a dispensary. You would go there if you are hurt, if you have these ailments, they would take care of you. But when it came to teeth, you literally had you had to really search. Is it that there are few, or is it that it was not important?
Answering that question, Moses, we are very unfortunate that in a third world country, we have very few very important professionals in the dental industry. Just like him, I also grew up in a very remote area, very far from Nakuru town. And you can imagine, after my high school, I had to travel all the way from a place called Bahati, in the hinterland of Bahati, all the way to Kirimambogo, combining, I think, 4 or 5 vehicles to go get a dental filling. And unfortunately, they did an extraction instead. And that is also what drove me to the passion of being a dentist, so that I can challenge that we don't have to remove teeth. And indeed, we are very few. Dentists, we are pulsely above 1,000.
What?
In a population of 56 or so million, we are pulsely above 1,000.
Really?
Even our diploma counterparts would be under 5,000. So
Wow.
combined, around 6,000 professionals are what are driving 56 million people. Their dental health is the hand of a handful of Kenyans. In fact, I joke with my colleague, I used to be in Karatina because we wanted to, that he cannot die because 50% of the dentists in Karatina would be dead, And so it's a very good cause for those who would know and tell their children, their nephews, their nieces. This is an industry to watch out on.
It's sometimes, I am a guy who likes statistics, and that's very, very serious.
Indeed,
That's serious.
Indeed it is. And that is why dentistry becomes then expensive, because the availability, the way that business will be managed, and even the resources required, the equipment, the specialized equipment that are required, and the set skills that are required to train these dentists, they don't come cheap.
Wow. I'm mesmerized. Those are very interesting statistics. Eh?
Yes, they are.
Just to think about it, because, it never hit my mind, because when we used to have teeth problem, thank God, they would just remove them. Literally, just remove them. And I think that's why many Africans have less teeth. By the time they're aging, Now, let me ask you something then. If that is the case, Dr. Gaitho, what's going on? Maybe how many are trained in a year, if you have the statistics?
We are looking at 30. Nairobi University, I don't know whether now they are doing 40
What?
in a year. Moi, by then, they used to do 10 or 15. I don't know whether now they've gotten to 20. I wouldn't want to go on air giving
Yeah, of
wrong
course,
information,
yes.
but it would be plus or minus very few. So combined, we are looking at around 50 or 60 graduates.
Even if you said less than 1,000, really, that's a
Yes.
very small number.
And you see, the science is not old. This started back in 77. Basically, this generation. Before then, there was no any training in dentistry. For the longest, it has only been Nairobi University, then Moi University. I think KU, I don't know whether they've started or they're starting, or something like that. You know? So we have very few people, and even the diplomas, the equivalent of clinical officers in dentistry are called community oral health officers. They are called cohorts. They're also well trained in KMTC. Again, the only one in Kenya should be Nairobi KMTC,
yes.
and Mount Kenya University. You know?
Now, that begs a question then. Getting quality service. How likely is that? Because if that is a ratio, getting quality service, you'll have to pay, again, I go back to your tooth, a tooth and a nail.
Yes, you pay generously. And also, you're not even sure whether you are getting the right person.
Yes.
Because then it's an industry that would be easily be infiltrated by quacks. Because so long as they know the direction a tooth needs to be pulled, then they'll pull without a second thought. And again, it's not rocket science to extract a tooth. And I think that is why they escape with it. Two, it's not an area that has a lot of issues to do with complications. It's not like heart, it's not like the brain, you know. So it's an area that people easily get away with. Rarely do our patients suffer major issues.
Wow. Then the thing we should be talking about here, if that is the case, then I think that's an area of focus.
Yes, it is.
That's an area of focus. Wow. I think you've scared me.
No, you should not be scared, because luckily that's why you invited Elephant Dent.
I tell you, there's a... So when you talk about those who... Then it's, in my view, I'm just looking at it this way. I've seen more private, private practitioners. Because when you go to some of these institutions that are basically public institutions, you always will find that there's no, the dentist is either not coming in or he comes once a week. Now the other narrative, I want to talk about a narrative. You know what's a narrative? The narrative that the cure of teeth is removal, is rooting it out. You know, we grew up with that narrative, that you have a tooth problem. In fact, anybody will tell you, enda ukatoe. Even the old woman in the village, enda ukatoe. Deal with that narrative. Any one of you.
It is, before he takes it, it is very unfortunate that people go for quick fix solutions that have long-term detrimental effects. And I pose the question for my viewers also to ask themselves. When you get a headache, why don't you remove the head? Because you wanted a quick fix. You know, actually your head will not pain you again.
Yes, it will.
Because you remove the head. Because it will not pain again. It will be separated from the body. So then why do you remove a tooth? Because it is paining if you don't remove the head. And I don't know whether you'd attack it differently, because it is basically wrong.
I think I like your approach. Moses, I think that narrative is changing, because as we talk about innovations, one of the things you will discover is that people are learning, people are getting information and knowledge. And it has come to a point where people have come to know that the cure for tooth is not extraction only. So as information and knowledge continues to grow, people are beginning to realize that there is something else that can be done to keep the tooth instead of extracting. And like you said, when you look at places like most of the private practitioners nowadays, they have a way of offering majority of these services, starting from conservative dentistry that involves restoration and filling of the teeth that are, they are decayed and so forth. So instead of that, we are in the process of educating our patients to begin to value and to realize that something else can be done. However, when you talk about the places like the government facilities, as it were, one of the challenges, our health systems. Sometimes you go to a place and you realize, in as much as there is maybe a doctor who can be able to fix your tooth, maybe there is something that is lacking in terms of supplies, material that are required for filling. So sometimes the only treatment that you can get there is only extraction. So those are some of the challenges that we have.
I'm just speaking what you're talking about, and I'm asking myself, then the information out here is different from what you people have. Did you know, I learned, I think it's from a dental practitioner not far from here, that I don't need to remove my tooth. I had gone telling him kuna ingine ya kutoa hapa, you know. He told me, no, you don't remove your teeth. You don't.
Yes.
You first treat the tooth, don't remove it. And it was like shock to me. I thought they were joking. And they did something, and I still have the tooth today. So are we saying the information out here, or the practitioners are not giving more information out here, or there are no outlets? First of all, thank you for at least you came today. Information out here.
Yes, we are here today now to tell Kenyans that, and everyone watching in diaspora and everywhere, that you don't need to remove your teeth. The simple treatment for a paining tooth would either be filling, which can either be simple or complicated. In simple or complicated means depending on how far the cavity was to the pulp. The pulp is the center part of the tooth, the living part. So if it is infected, you treat the infection. So you do such treatment. Commonly nowadays people know it called root canal treatment, where now you are treating the root canal system that houses the pulp, the blood vessels, and the nerves. So if you remove the receptors of pain, then that tooth will not pain, because that is what they call killing the tooth. Unasikia jina yangu imeenda kuuawa. So part of my body is killed ahead of my time. So you remove the living part so that this is a shell, a bony shell that can serve the other functions. You can smile, you can chew with it. Though over time it becomes brittle and weak, which again we know how to manage that. You cap it, you do a crown, then it's able to serve you without pain.
Are these innovations that have come along, the dentistry, practice? Some of these, like the root canal, because I came to know about root canal not many years back from today. I came to know about most of these procedures, because you begin now to ask yourself, must I remove all my teeth now? And then now you get, and it's when you get a professional, and I really like that, because I remember I really had that question, do I need to remove all my teeth? And then he told me, no, this is what you do. And now we're beginning to see people now are doing more restorative than extraction. So what are the key milestones we can see that the practice has gone through?
Actually, as we titled our interview today, we call it revolution and innovations. But we actually missed out on evolution, how it has evolved. Okay. And maybe that is why you invite us. Okay. Maybe that's why you invite us next time. But maybe I'll give you a snippet that dentistry dates back BC in Mesopotamia, where scientists then would look for solutions other than extractions. And even extractions, the way they would use crude weapons or crude gadgets.
I was reading that very late in the night.
I can imagine. And you know,
I saw a guy with
yes, with a sledgehammer and a would-be a chisel or something.
What?
And remember, there was no anesthesia.
Yeah.
Anesthesia is a development that has come much later.
Yeah.
So one of the anesthesia would be 4 or 5 heavily built muscle men that would hold you down like a cramp, you know. So basically you cannot move. Then they will basically torture you in the name of alleviating your pain. So you wonder which one is better, the one I was with or the one I'm feeling now, you know. But now over time, that has changed. Now there's a use of drugs, there's a use of, and you know, herbalists take advantage of what they don't even know. I once used a matatu when I was in third year to go to some place, and I had someone get into the matatu and hawk some vial of some concoction, and they would tell people with some toothpick, your tooth that is paining, just pick with a toothpick part of this concoction and dip it right into the pulp of the tooth. Instantly, the pain goes away. And you know that is true. What they don't tell you is that you've just killed that tooth. You've killed the environment around that tooth. It's like using formalin. You know, formalin that you use to fix bodies. So they use concoction, they don't even know what it is. All they know, it has such detrimental damage to the tissues, they cannot survive. They can't even feel pain. Then the tooth now shatters and crumbles. So you'll see most patients who have used herbal solutions, they have retained roots. Retained roots are the part of the tooth that is buried below the gum, because everything above the gum. And you know, this is uniquely, this is orthopedics. We dentists and orthopedics have a place they meet, because we all deal with bones.
Okay.
A tooth is a bone,
it's a bone,
but a unique bone that is emanating from that is visible. The rest of the bones are well covered, so orthopedics are happier. For us, our bones are exposed to an environment that flows in bacteria, food, you know, the list is endless. So to keep that balance between the bone exposed and the jawbone supporting it becomes tricky. And so people need to look out on good and correct information.
It's amazing. You know, I think information is everything. When you look at what people have, wow. You know, I've encountered that sale. Not even in matatus. Now they even work in offices.
To offices.
You know, and you know the problem of a tooth. You know the problem of a toothache. A toothache is something. One time I met somebody in the estate at 3 a.m. walking in their night gown, and he's just mumbling.
I don't know whether you'll ask me, why does dental pain increase at night?
I don't know, but
because it's
you
like
need to tell us.
Sent by the devil, you know. So toothache, you know, it's the second severe pain to cancer pain.
Where?
It only competes with cancer pain.
My goodness.
And it does not stop. And it throbs.
Shoot.
It moves the pulsation of the heart. Then it increases at night. But now as a scientist, I'll tell you, it does not increase at night. Is that the way the brain operates, it gives priority to important things. So during the day, Moses, don't laugh. You need to drive. You need to eat. You need to digest food. You need to breathe. You need to talk on phone. You need to type an email. So the brain is receiving a lot of important information.
Yes.
Including what you eat, how you eat. You know, you cannot talk and eat at the same time, rest, you choke. Now, during the day, the same tooth that was paining is emanating pain, you know, stimuli. But the receptors are busy concentrating on other things. Like now you are driving. I have a friend who came all the way to Meru. I practice in Meru, that's where our head office is. And he came with his wife. When they drove, in fact, this is barely a month ago. I treat patients from all over Kenya. So he was coming from Kikuyu to Meru. So he was in pain. I managed him the night before, gave him some medication to take. But the following day he said, it's too severe, let me come for the root canal. He drove, he was barely feeling pain. He could feel it at a distance. But up to Keno, he decided, no, you are the patient, let the wife drive. They switched. before they would get to Makoyo, now this is science, proven, he could, you know, they had to stop and look for painkillers. And yet he was not in pain when he was driving because the brain concentrates on, I don't want to cause an accident,
Yes.
not there is some pain. So when he stopped driving, everything now calmed down. He's not the one who needs to overtake. The pain shot. Why? Because now the body, the brain now is dedicated. Now, what were you guys saying now? I have time for you. Oh, you have some pain. So now, you know, I have to manage him now along the way.
You know, me, I think my mind thinks, you know, in pictures. So I'm trying to. I was in a hospital one day, and this lady drove in properly too. Then when she arrived at the entrance where the emergency where people are picked, she just jumped out of the car, started collapsing.
Yes, yes. And he had come on. She
She had driven in the traffic too. So now that explains it. Where Mr. Morris Muiruri is saying you are talking good.
Wow,
He's saying you're talking good. We have Jacob Musioki is tuned in, Cyrus Mogo. But then there is Jane Kamau. She's asking, I'm liking your conversation. Thank you. Where can I find you for treatment?
Whoa.
Jane, you need to
know. You need to tell us where you are because we are in 23 counties.
All right, Jane, today you will get treatment. I tell you, today you must get
Absolutely.
treatment.
Yes.
As please keep conversations running on YouTube and on Facebook. We'll be just going through them. We have a few minutes to a break, by the way.
Okay.
And I want to just give it, just to ask this, maybe we'll pick it up later. You've been practicing for the number of years. What are those, you know, people come, you know, it's like when you stay in some areas, they tell you here there are only chest pains. People suffer from, what are the key things that people bring to you? And you know, you don't even need to have a headache. You know, they are common.
Moses, mostly when people come to us, most of the people will come because of pain. And especially the pain that he was talking about, the pain that denied you sleep. And so when we look at our patients, most of the times you discover the pain is either coming from the tooth that is broken, that is decayed, or the pain is coming from gums that are swollen. So most of the times, and commonly, like you are asking, we have two most common diseases that are affecting our dental health. And most of them, one of them is what we call tooth decay. We call it dental caries, which is basically the decay. And the other one is the gum problem, the gum disease. So gum disease is a big name that can start from the small bleeding of the gums, going all the way down to someone having loose teeth because of what he was talking about, the destruction of the bone where the tooth is planted, as it were. So most of the two of these diseases are very common in the population, and most of the people are coming with these complaints, these issues. So tooth decay.
Okay.
Tooth decay commonly is caused by bacteria, and also poor oral hygiene, because people are not doing the right brushing of teeth, and probably they're not using the right toothpaste, as it were. So we'll talk about that maybe some other time.
You're going to talk about it
But,
today after.
but tooth decay is one of the major leading cause of tooth loss.
All right.
And tooth issues that people are bringing to us.
We're going to go for a break. Huh?
Yes.
And we have a few people here. We have Chris Mogo, Cyrus Mogo is say hi to my cousin.
Yes, he's my
So
cousin.
your relatives are meeting you
Yes,
today.
I can see that. I can see that. I give him a high five.
Beryl is on site. Kelvin, Perry Wamboy is saying she's following the conversation. Moha is saying this is a great conversation. And then you have one of your guys, Kiprotich, saying my CEO.
My CEO here.
So Kiprotich, make sure this man adds your income.
And I salute them. Thank you for
Yeah. We're going to go. We are going to take a break, and after the break, we're going to look at several things and look at elephant. and just discuss elephant as a brand and see the milestones and what. And I have to tell you this for free. It's visible.
Wow.
And I think one of the things you need to know about a brand, when it is visible, then something is happening.
Wow. Thank you. Thank you.
Okay.
Before
So we're going to take a break, and please remember, you have the opportunity to learn from our experts. Dr. Gaitho is in the house, Sylvester is in the house, and even others. But remember this, you need to send in. Don't call the numbers, just text in. If you have to do a WhatsApp, please do that. But remember, we are on Elevate. Call your friends, tell them we are on Elevate, and we are running the dental agenda. See you after the break.
Thank you.
Join the Hope and Beyond Women Conference on November 2nd, 2024 at Fungamano House along State House Road or Mamlaka Road, Nairobi from 9 a.m. to 4 p.m. for a day of inspiration and empowerment. With the theme, Give Me a Child or I Die, from Genesis 30 and verse 1, speakers Pastor C.E.O. of House of Grace Nairobi, Reverend Lydia Kahiga of PCEA Karuthi Parish, and the host and lead pastor of Hope and Beyond for Women, Servant Betty, would deliver powerful messages of faith and healing. Enjoy uplifting worship with the H&B Music Ministry. Tickets are 1,000 Kenya shillings with a decent dress code. Secure your spot via M-Pesa Paybill 891-300, account number 100194. Don't miss this life-changing event. If you need more information, please contact us via 0726 349 743 or email us on hopeandbeyond@poweredbychrist.us. Hope and Beyond Ministry helps women birth hope and provides a pillar of hope to women. We are Powered by Christ Ministries.
Well, welcome back. We are back and we are dealing with the dental agenda. We can see many of you online. Morris Mushiri says proper dental health care, the education right there. Jane Kamau is in Roiro watching. We want you to call your friends and let them know that we are on air. James Wambua is tuned in from Embakasi South, anasema tuko pamoja. And Ngui Millicent is in a good talk, which is the best toothpaste to use.
I know.
So he's the one who brought the issue of toothpaste.
Yes.
In fact, I think today we're going to use your props. As we look at the props, we are going to look at them. Joe Wisdom is watching in. Joe Fat B is following the program. It's a good teaching. Faith Athiambo, she says, I now understand why dental care is so expensive. And sometimes people don't have a problem in payments. The people feel when somebody has this thought that I'm being ripped off is when they have a problem. And I think that is because I think they've never looked at it the way you put it today. When you go to the dentist, you're going to pull out a teeth. But today, at least we learned you don't need to pull out a teeth. Let me ask you about there's something I was listening and I thought about it Because I've seen innovations, and I watch a lot of documentaries, and I was seeing something on laser dental care, you know. Maybe you can discuss about it, and do we have it in Kenya?
Yes, we do.
Wow.
Yes, we do. Laser and LASIK surgery and laser management. We are especially using it in our periodontology.
Okay. Okay, Kiswahili.
Yes. matibabu ya ufizi. Ufizi ni gum.
Okay.
Instead of getting my scalpel and cut off a destroyed part of the gum, then I can use laser to scallop any enlargements on the gum, you know, because it will have minimal invasions, it will have less complications, and even the healing is much better. It accentuates and potentiates the healing because you don't have to go through bleeding, you know. Then in terms of precision, it will give you nice results. Then, so laser, of course, is the way to go. It's one of the new inventions in the industry, and it's already it's already around.
So, you know, I was to ask you about, you know, the movement from just the old, you know, the way a dentist would walk into, when you walk into a dentist, you see those silver things you see. You are just intimidated in, my friend. You know, the way they are, they align, some of them, you know, and you wonder, this guy is going to put this thing into my tooth, you know. They're so intimidating. But today, I think we see less of that. We are seeing less of that. We are seeing very clean dental clinics, you know, very, very well done, and the kind of care that somebody is, you know, people are receiving. Would you want to talk about the new, you know, the treatments and the care that now people are receiving? You know, for the first time, I went into a dentist clinic. I came out and he actually gave me lunch money.
Whoa.
He gave me lunch money. He told me, go and eat. If it pains, come back here.
Come back. Wow. Wow. That is where we are. Today, dentistry, I would be a dentist if given another chance.
Wow.
Why would I say so? Because of the results and the report I receive from my patients. And when I know I've attended to a patient, inject my skill to the best of my training. But I want to talk about the phobia, dental phobia.
Whoa.
People fear dentists by even the thought of it. Pain is our major employer. Pain employs me and this guy. Without pain, many Kenyans and human beings will not go to a dentist. But I'll tell you, today we have something called VR. I know Arsenal fans are wondering, VR tena daktari, you've missed it.
You're missing it. Take us back.
Leo hatuko manu. We have VR, virtual reality in dentistry.
Yes.
The innovation is you want the patient to be as calm as possible. I don't know that you've been to Garden City or Two Rivers. There is a place kids go and they wear some goggles.
Yes.
And they sit on some seats that take them through roller coasters, and you know, by the time they are coming out, they are whoosh. Now, that is for fun. Now, bring it now into dentistry. If your patient walks in, you know they are afraid of seeing these things. Now, today, we don't. And how did you know they are silver? I think it is true. You are a good patient. You've been to serious dental places. Because I think almost all our instruments are silver. So I think you are right, Moses. Now, we don't introduce those items as the patient is seeing. So we keep them off. Then now we introduce them one by one. Two things. Number one, VR, you are able to wear the goggles, and it takes you through landscapes that you would enjoy. Maybe you can be watching music or movie, or even you go through, you know, areas that you've never visited, you know, like the roller coasters, so they can take you through maybe mountains and valleys and, you know, all that. When you are busy watching that and your mouth is propped open, the clinician is busy fixing your tooth. So you'll not even know he's done. That is how we are bringing it in. That is number one. Number two, the use of painless injections. I don't know whether you heard that.
Yes. I have to admit, I went to a clinic of this gentleman.
Oh.
And he applied something on my gum. And he just injected. I was nearly telling him, Ongeza.
Painless injections, yes.
Painless injection.
Elephant Dental, we have specialized in that, including kids. Nowadays, there is no point of tethering your child or holding them down. No, painless treatment, and that is now old school. The application of topical anesthesia or even the spray, now we are moving now from that.
You're forgetting to say something.
What, which is?
It tastes like gum.
Yes, it is definitely flavored.
It's flavored.
Now there's a gadget that now injects the anesthesia painlessly.
Wow.
Yes.
Let's talk about Elephant
Elephant
Dental. And the brand, inception, and the growth we are seeing.
Wow. I think I would be best placed to...
I'm very, of course, I'm not trying to flatter you. I have noted, and I think the first time I noted, I told you, I thought my dentist had closed down. And then I went, I saw it somewhere else. I said, hey, this guy. And you know, we live in a propaganda world. Kenya is a country of propaganda. So now there's a politician who is hiding money and he's buying all dental clinics. So this is a politician.
this is the elephant of
this is the elephant.
Dental. Elephant of elephant
so you know that propaganda.
Yeah.
So tell us about the elephant, and I think anyone can answer.
Maybe before he, because he is the elephant himself. I will agree with what you're saying. My background before I joined Elephant. When I finished my training, I went to Kijabe Hospital. That's where I did my post-training internship, and I also did a few things there. And later on, I joined an organization called Touching Lives Ministry, which is an American NGO that has a daughter organization here in Kenya, which does short-term medical and dental missions in the communities. So I actually, even up to today, I help them to coordinate those medical and dental missions. I happens to be their director in dental, and along with that, I also started practicing in Nairobi, somewhere in Embakasi, and you all know that. So when I was in my private practice, I used to hear about elephant. And I could see, branches here and there.
This elephant is not in the forest.
So one time, I think in Thika, I stopped somewhere in Thika, and I saw this big signpost written Elephant Dental, and I was wondering, what is this elephant?
Do they treat elephants, or are they elephants themselves?
So when I saw this, I became passionate about Elephant Dental. And sometimes you never know. Always God has a reason for everything. So the moment I saw that, and it began to, to run in my mind, I knew maybe God had something. And at some point, over the years, I came to meet this guy, who is the CEO and the founder director of Elephant Dental.
Wow.
And now, after joining Elephant Dental, now we have a branch in Imara, Daima. Wow. I am the branch director of that Elephant Dental Clinic, branch Imara, Daima. And I feel like I don't want to talk about Elephant Dental when he's here. So I think now...
You're a beneficiary.
I'm a beneficiary.
Talk to us about dental. And as you do that, there's someone here, Ultima Baya, is asking you, do you accept SHIF? And then, And he's also asking you if you have a branch in Nairobi. Yes, I think I can answer for you.
Yes.
You have enough branches.
Enough branches, yes.
So you just need to tell us where you are. Now, Elephant Dental, where did it come from?
Elephant Dental. Dr. Gaitho graduated from University of Nairobi back 2006. I was the best student in the year 2005. I have blessed and gifted hands, fingers. In my training, I don't remember struggling to do clinical treatment. And being a Christian, which I've always professed, I carried the values of a good Christian in my practice. Elephant Dental, it was heralded by a company called Everest Dental Group that we started, the two of my former directors, that we ran for 6 years, from 2009 to 2015. Elephant Dental was incorporated in 2015, March 9th, and we started with 3 branches. That was Isiolo and Thika. We are headquartered in Meru.
Oh.
That's where I sit.
You know, Meru is in the limelight.
Meru is in the limelight. I don't know for what reason. I'll not say good or bad. But I'm not a Meru. I didn't have friends or enemies in Meru.
It's a very good town.
Yes, perfect. God sent me there just like he did to Abraham. So Elephant started. The vision of Elephant Dental is around 15 years. We are doing, this is now our 10th year. Next year we'll be turning 10. Next year, March. So we are on our 9th year with 45 branches. Were it not for the hiccup we hit in 2022, that we lost some of our branches, we would be around 70. But everything happens for a reason. We have one philosophy that I champion. Quality dental services, fair, affordable, and within reach. We are intentional about our quality of service. We are not pretending. This is what we do. When I tell you I will deliver, I do deliver, because God has given us that opportunity. And so when we open branches, what we are doing basically is telling Kenyans we can have dental services managed under one roof, under one house, with an intention to give you what you are looking for. You need dental services, good quality, look for Elephant Dental. And we are not stopping there with a branch network. We are now closing in with our first private referral dental hospital.
Wow.
In Kenya.
Wow.
Yes, 90% complete.
Wow.
That just like you know Kijabe for bones, just like you know Kikuyu for eyes or lions, now you'll know teeth with the elephant. The elephant will take care of Kenyan teeth before we go diaspora.
Wow.
We are putting up the first private dental referral, teaching and referral hospital.
Wow.
We almost done. Kenyans will benefit from this because after Kibaki ran this government for 10 years, he left a very good road network. The other successive governments have come on it to improve, but you can get good services right at our referral hospital. In that place, we'll do training. We will do quality treatment, surgeries, complicated, simple and complicated. And the quality we will produce, and I think this is what you need to take home or write somewhere, is the quality of the clinicians that we will produce at Elephant Dental Training Center.
This is going to be in Meru?
Yes, it is. It is already in Meru.
Wow.
Soon it will become a university.
Yeah.
We will train degree courses. We will move to master's and PhD and all that, but we will grow gradually. And other than training, other than the clinical services, I've had people ask, which is the best toothpaste? I don't know whether I should pass the bubble now or...
It should be answered, and then prepare to show. There's something you said about oral health,
Yes.
and just normal care.
Yeah.
You're going to, I think you need to do that practically, so you get your props. The toothpaste, you know.
Toothpaste.
you know, we come from a loyal. Let me give you our stories here. Kenyans, we are very loyal to products. You know, like when you are growing up, and you know, if you are growing up from the old, if you grew up in the village, there was a soap which if you used, you looked a cool kid, you know. And now again, we went to Colgate. Then we went to, then there are many brands right now. There's the other day, I've been having some sensitive teeth. And somebody said, change your toothpaste.
Oh, toothpaste.
And I did, and that thing just disappeared. So that's how I realized you can do that. Now, tell me, answer this question. What is the best toothpaste?
The best toothpaste, I will be honest, because I don't want to be crucified by Aquafresh or Senso, Pepsodent, or Close-Up, or Colgate. Which one did I come today to talk about? Is it Sensodyne? I'll tell you. As long as the toothpaste has met the Kenya Bureau of Standards parameters, you couple, you know what toothpaste is, and I think many people don't know. This is soap.
Okay.
Sweet soap.
Okay.
That is not, of course, the normal soap. That is embedded, let me use a language viewers will understand, sandpaper. You know sandpaper that will clean any surface, whether metal or stone or wood. Now, the quartz or the stone pebbles in the sandpaper is what has been crushed and added a few fillers to become toothpaste. Now, when you put toothpaste on a simple toothbrush, like this one, this is a very subtle item. It's like just very soft.
Okay.
But when you put gel sandpaper, it means you can tear off any surface using the toothpaste. Now, some toothpastes are medicinal. They will remove the sensitivity. Now, the right toothpaste, now depending on your pocket ability and how much should you use. Some people use too much. It is not the quantity, it is the quality and the efficacy of the brushing method, the brushing style. And I don't know whether, though I leave my colleague to do that, there is the formula which you should use when you are brushing. Sometimes we leave some areas unbrushed, especially the inner surface of your teeth.
Okay.
Probably this is the match someone is about to open. But you'll find people enjoy brushing the outer surface, and they do front back because it is easy and quick and you don't even need to think about it. Then you turn the front side and you go to the back. The correct stroke should be up down, again along the grains of your teeth, because when you cut across them, you are cutting the gum line. And people come down with the sensitivity, not because they don't brush, but because they brush the wrong way. One, you exert a lot of force when you are brushing vigorously. Now you're supposed to do up-down strokes, removing the plaque, removing the food debris, up-down, all right? Then you're not supposed to put a lot of force. In fact, I thought in these innovations we'll talk about, there is what now we are calling smart toothbrush. What is smart toothbrush? You know about smartwatch.
Yes.
What does the smartwatch do? It will tell you how much you're walking, how fast you're walking, how many calories you're burning, and just the way you're interacting with the gadget. Now we have a toothbrush that is smart. It tells you how much force you're applying.
Okay.
If you put too much, then you have an app on your phone, so you are able to see it has the picture of your mouth. Then when you're using the brush, then it is showing you the stroke you're supposed to use and how much force. You put too much force, it shines red. So you want to stay on the green.
The way we have civic education when we are voting, this is what we should do. We need civic education.
Yeah.
Yes, on how to brush, so that you don't cut down your teeth. But now, as we have said, with innovations, now we have come to rescue Kenyans from brushing wrongly.
I think you guys give a lot of work. There's a man here, Pastor Chris Kimaro, is saying he has been served by you. He accepts your service is good.
Thank you, Pastor Chris.
There's a man here who is so insisting. Miss Akoya is still asking about Chief. I think he needs to go to his dentist. That's where he should be answered from, because
yes, we already registered by Chief in Meru, and we are busy onboarding the other branches on Chief, because what the government is doing is avail these services to every Kenyan, and now it will not be a preserve for few. so that if you once, maybe in 2-3 months after all the dust settles and now the systems are in place, now you are able to use your sheaf in any of our elephant dental clinics and you're able to use it. But now, not now, because we are busy onboarding the other branches.
All right.
But in Meru, you're already onboarded.
So if you go to Meru, Mr. Otil, you'll be treated with your sheaf. Sylvester, oral health. And I want you to use your props today.
Yes.
And I want to give you a few minutes because we have less than 10 minutes. And just...
Thank you very much, Moses. Before I do that, I think I will touch some things more related to the question of toothpaste. Because most people think if you put your toothpaste in the mouth alone, it does the work of cleaning the teeth, which is wrong. So as we talk about toothpaste, we also have to look at what else do you need and how do you need to do it so that you can keep your, your oral hygiene clean. And when you talk about toothpaste, because like he said, we are not here to promote any brand, but as it were, when we are talking about toothpaste, one of the most important things when you look at every toothpaste that has, that is Kenya Bureau of Standards, certified. There is something when you look at the active ingredients of every toothpaste, you see there are what we call the mineral elements. We have what we call sodium.
Do we even read?
We have fluorides. We have phosphates and so forth and so forth. So looking at those mineral elements, the reason why they put these mineral elements on toothpaste is because these mineral elements, after brushing your teeth, they provide a coating on the enamel surface of your teeth. And that protects the enamel from, decay, from anything that can invade the tooth and destroy it. So those mineral elements are very important. And when you look at, like when people ask about those toothpaste, that's one thing that I look at. Because
let me ask you a question.
Yes.
And any one of you can answer this one because our time is going. When you talk about toothpaste, does it mean if the toothpaste is good with me, it will be good with him? Or, does it react differently to different people? Because some people, because when you begin to put up those ingredients.
So there are some toothpaste that we recommend for specific conditions.
Okay.
Especially when someone has gum problems, there are some special toothpaste, like we was talking about. If someone has sensitivity, there are some toothpaste that we recommend for that. So it all depends with the condition that the doctor has found with that particular person. So I think that's key. And then going back to the cleaning of teeth, like we say, toothpaste is paramount. But again, we have toothbrushes, and most people, when you are brushing your teeth, they have toothbrushes that probably they bought, 1 year ago, 2 years ago. And when you look at if you want to know that you have a good toothbrush, you have to look at the bristles. Kama zimelala, kama kifagio, you should change.
Zina hug each other pande ya nyuma hivi.
Yes, so you should change your toothbrush. And actually we recommend
Sylvester, you should know, these legends, they went through college with one.
That is where now we are here to tell them. In fact, mentioning about the ingredients is talk about the fluoride, the triclosan, the carbonates, the layer that is left on the mouth. The mouth, what causes dental caries is the interplay of 4 factors, and I'll run through them briefly. Number 1 is the most important, is sucrose, sugary stuff, which you leave in the surfaces of the teeth. And once they are left there, the bacteria, Streptococcus viridans, they ingest them. Then they produce a byproduct, which is hydrochloric acid. Now that is what destroys the tooth. So those 2 factors, then the tooth surface and time, because even if you leave them today and by tomorrow you clean it, then there will be no dental caries. But if you leave it for some time, then it will break down the calcium and the phosphate that forms the bulk of the tooth. But now for toothpaste that has fluoride, The calcium phosphate has some OH groups that is able to change. The normal tooth structure is called hydroxyapatite crystal. Now you change that with fluoroapatite crystal, it becomes harder. But again, for our friends from Rift Valley, Naivasha, Nakuru, they have a lot of fluoride because the fluoroapatite crystal, if you put too much fluoride in water, then the chemical structure of the tooth becomes weaker. But there is a place where the interchange becomes beneficial. If you use too much, more than I think 7 parts per million, then it becomes detrimental.
Let me ask a question. Our time is literally going. Our time is just going out. There's something you've touched, and we just want to give an answer. I've traveled to Gilgil and some parts of Nakuru, and I've noticed the dental color of many people around there. What is the problem?
Fluoride.
And what is the cure?
The cure is don't use borehole water to begin with, preventively. When you use water with less fluoride, like I said, we use not more than 7 parts per million. That is now recommended in the toothpaste. But now for the water, if you use rainwater or any other surface water, but now for Rift Valley, because of the volcanicity, a lot of our water has a lot of fluoride.
Okay.
So when kids are brought up, they take a lot of that water, then the formation of their teeth gets more fluoroapatite crystals than hydroxyapatite, which is now the correct crystal.
Another myth. When toothpaste imeisha kwa nyumba, we take salt. That's my mother, 100%. Is it true?
Yeah, of course.
We grew up like that.
Yeah. So that's a myth.
I have less than 2 minutes.
And of course, we are moving away from that. So essentially, when we are talking about, like he has explained, one of the most important thing when you are doing your cleaning of teeth, you should have those components in a toothpaste so that they can protect. So like you're saying, salt will not have those kind of components that are important. So of course, those are myths, and some people actually use charcoal, you know. So importantly, I think people need to come to a place of understanding that toothpaste that are commercially manufactured, they are important for protection of teeth and for prevention of dental decay and gum problems.
For the sake of time, we are about to close down. I want to give you each a parting shot, but before I do that, we have very many people online. Daniel Kamau is tuned in from Githurai Elephant Dental. Morris Moshiri, toothbrush changing is paramount for effective brushing. Wow, every 3 months, he says. I hope that's true. Elephant Dental, Banana.
Oh, Moshiri.
I hope you didn't send a memo.
No.
Pauline Nix is there. Busolo Kelvin, kuna toothpaste huwa tunauziwa kwa gari na ni cheap na ni kubwa mpaka unapewa.
Wow.
Busolo. Mungu akusaidie. I want you to give a parting shot. As you welcome people to, as you talk, less than a minute, a parting shot, I want you to know that Elevate is in Meru. We are in Meru. We beam from actually Meru.
Wow.
That's where we beam from. So the whole of Mount Kenya is covered. Wow. So send your salam.
Wow, thank you. Thank you, Elevate TV. Thank you, Moses, for having us today. I thought we would get more time. I didn't know our lapse is so fast. I had even come with our assistant administrator to talk about our Elephant Dental Month. That's something I didn't tell you. We want to attend
I'll promise you are coming back.
Oh,
this is a promise.
Thank you.
On
Thank
live
you.
TV.
I will come. I will come and tell Kenyans the good things we are doing. The whole of month of November, watch out on what Elephant Dental is doing. We'll be attending to our 50,000 Kenyans.
Wow.
The whole month, all our 45 branches across the country, Saturdays and Sundays, we'll be going to mosques, we'll be going to churches, we'll be going to schools, even if they are closed. They'll be going to public places, we'll be going to children's homes to visit and teach people on dental care. And we invite you to listen, watch on our Facebook, on our YouTube. We have a channel, and listen to what we are doing. We are very intentional about the quality of dental care Kenyans are receiving. And as a CEO, I'll tell you, this is what God called me to do. He asked, what on earth are you here for? This is what I do. Meno na neno. And so, and welcome our viewers to watch out on that Elephant Dental. Our month, we hope will attend to you. And in subsequent months and years, we'll always be improving, getting better, until we do our marathon.
Yes,
yes. When we launch our hospital, definitely we'll have a marathon. Elephant Dental Marathon. You can be sure.
Sylvester, your parting shot.
Thank you. I said I am the brand director of Elephant Dental Imara Daima. And so I am calling upon the people of Embakasi, you know, Imara Daima. In those areas, we have a clinic located around Kobil, Caribbean Building. So we are calling you, especially this during this Elephant Dental Month. We are going to be there. We are going to offer, you know, affordable services. We are going to do checkups,
discounts,
and we are going to have great discounts for our services.
Wow.
So karibuni sana, touch base with us, visit us for checkups, and we'll be glad to serve you.
Wonderful. Just because of time, we have to go, but all of you online, I am so grateful for you being part of this conversation today. Remember, keep it elevate, keep it elephant.
Yes.
And as we
elevate elephant.
as we go into November, I believe we're going to find a time to bring Dr. Gaitho back in Sylvester, so we can know what's going on in the month and what we can and how you can reach out to them. But remember this, Elevate is here, advancing kingdom lifestyle, and we thank you for watching. Your numbers on the screen there. Please let us know what we can have better, how can we make the program better, how can we make the production better. But remember, this production comes up just for you, and that's why we are here. And I want to thank my guests. Thank you for making time from your I'm sure your patients are waiting, but tell them we are doing a noble task.
Yes, sure.
Thank you, Daktari.
Thank you.
And Sylvester for being here. Well, they have said it all. See you next Wednesday. God bless you. Keep it elevate.
Thank you, Elevate. May you continue being elevated as you elevate.
Thank you.